Healthcare in 2026 is going to change a great deal, and we have the answers as to what is coming in the future. Hi, I'm Tommy at medicalinsurancetoday.com. At Medical Insurance Today, we do a lot of individual market insurance for people that don't get insurance at work. That includes Cover California, and we do a lot of Medicare for seniors. To touch on first the individual market, we have a two-front storm coming with the individual market this year. So the first component to the storm is that there have been massive amounts of money injected through the Inflation Reduction Act of 2022. Money was injected into these statewide exchanges, specifically Cover California being California's exchange, that help people qualify for lower monthly insurance costs. Their premium was lowered based on their income. Now, as a family of four, as an example, if you're over $125,000, historically you never got a financial discount, and for the last few years, people over $125,000 have been able to qualify for a discount, and that is going away. That is drying up. That was built into the law when it passed in 22, that would expire at the end of 2025. So a lot of folks that are getting financial help now will no longer qualify. The second front of the storm is that this year is going to be one of the highest rate increases on record in Cover California and for California health insurance marketplace. Everybody's going to see a rate increase, but in Cover California, they advertise it as a aggregate across the state 10% rate increase across the board as an average aggregate number. Now, I looked at my rate increase and it's over 21%. So that doesn't mean you're going to get only a 10% rate increase. Historically, the average rate increase aggregate has been 5%, and so it is double that. And you're going to see a lot of people talk about their health insurance this year because rates are going to go through the roof. Unfortunately, I'm suffering to it as well. I looked at my rates yesterday and went, wow, it's going up over 20%. So not fun, but this is the reality. Regarding Medicare Advantage is losing a great deal of PPO Advantage plans. Historically, Advantage plans are HMOs. There have been the last number of years, PPO Advantage plans have become really, really popular, and a number of companies, specifically United Healthcare and Aetna and Blue Shield, are removing their PPO Advantage plans, and over the last couple of years, a few others have removed theirs. Excuse me. So there's only going to be a couple PPO Advantage plans available in California. That doesn't mean you can't get a PPO, but they're going to be more limited, and a lot of people are going to have to change their plan for their Medicare policy for 2026. This leaves us in a great position. Unfortunately, when there's trouble in the air, people come shopping for insurance. So we expect to be really, really busy. Our services are free of charge to our consumers. So if you'd like some help, please call us. We can quote you and put together a presentation as to what's available for you for 2026. Open enrollment starts October 15th. If we can help you, please be in touch, medicalinsurancetoday.com, and we look forward to serving you.